focuses on both the patient and the ventilator.
Mr. Kirkpatrick, I'd like to let you know what we're going to be doing today. We're going to place a central IV line in you, which is an IV line that will be placed either over here or here. This will give us access for giving you nutrition. You're not able to eat or drink when you're on the ventilator. You've already been started on antibiotics because your chest x-ray indicated that you have a pneumonia, and we will be continuing the antibiotics. Now, you're not able to speak because of the ventilator, so I have a little board for you here that you can write on. Do you have any questions right now for me? All right, then I'm going to go ahead and check you out from head to toe and do an assessment.
First, the critical care nurse assesses the patient's level of consciousness. Any change can be an early sign of hypoxemia or hypercapnia. If the patient is anxious, confused, or agitated, the nurse may suspect hypoxemia. If he's sleepy, it could be hypercapnia. This part of the assessment is particularly challenging in that the patient has an endotracheal or ET tube through his vocal cords and can't speak.
Can you open your mouth so I can check your mucous membranes?
Next, the nurse evaluates the patient's color. If he's hypoxemic, his oral mucous membranes and lips may be pale. A late sign of hypoxemia may be peripheral cyanosis, a bluish tinge to the nail beds, nose, ears, or fingers. Of course, the condition may also result from exposure to cold, vasoconstriction, or vascular occlusion.
Do you have good sensation down here? You can feel my hands? Great.
Patients on mechanical ventilation must have their breath sounds auscultated frequently. The nurse auscultates Mr. Kirkpatrick's lungs anteriorly, laterally, and posteriorly, comparing breath sounds from side to side for adventitious sounds, crackles, wheezes, or rhonchi. If the breath sounds are decreased or absent on the left side, the nurse is concerned that the ET tube may have moved into the right mainstem bronchus, or that he has developed a pneumothorax. In addition to the breath sounds, the patient's respiratory rate, depth, and rhythm are assessed.
And listen through the back if I can help you sit forward for me. You able to hold yourself upright? I'm going to check your respirations.
For a patient on mechanical ventilation, the respiratory rate is counted for 1 full minute, and all breaths, the ventilator's and the patient's own, are counted. The nurse also checks the blood pressure and pulse.
And we'll get your blood
Some
pressure.
patients may have become hypotensive and tachycardic when mechanical ventilation is first initiated and may require fluids. Generally, this is seen with volume-depleted patients.
Your vital signs look good. I'm just going to check your ET tube right now.
To determine if the ET tube is still in its proper place, auscultate breath sounds and evaluate the chest X-ray. Also, the ET tube has marks on it to determine placement. The nurse notes the centimeter number at the teeth and by routinely checking the mark can identify tube movement. In order to avoid excessive pressure on the tissues of the trachea, most ET cuffs are high volume, low pressure. Some clinicians use the minimal leak technique, whereby you auscultate the trachea during inspiration and inflate the cuff just enough to keep air from leaking around the cuff. The pressure is verified with a manometer to make sure that it is not greater than 25 centimeters water pressure.
I hear just a little bit of air escaping, so we'll check the pressure on your cuff. Just slightly low, so I'm going to add some air to it. Perfect. I'm going to check your ventilator now.
As a critical care nurse, you'll be responsible for verifying the ventilator settings, including the FiO2, tidal volume, mode, rate, and anything additional, such as PEEP or pressure support. Make note of the peak inspiratory pressure and the temperature within the system, and check to see that the alarms are on. Patient safety is, of course, a #1 priority. Each day, the patient is weighed and intake and output is calculated to assess the fluid balance.